is, of course, October, and we're continuing some much needed conversations around breast cancer awareness. And when you hear that word cancer, it's not just one person that affects, it's a whole family, it's a community. And one of the things so many patients hold on to is hope. The hope of treatment, the hope of new treatment, forever being researched, tried and tested. And with us now is Dr. Annett, consultant breast and general surgeon, the clinical lead of breast cancer at Mediclinic City Hospital. Talking about a new treatment that's not here in the UAE yet, but as I said, Dr. Annett, sometimes it's about the hope that can be so motivating and fortifying for patients. It's called Vision 1. Thank you for being with us today. Really do appreciate your time. I know it's an incredibly busy month for you as a breast cancer surgeon. Tell us about Vision 1 trial. What stage is it currently at, and what makes it different?
So it's actually not a treatment as such. iVision is a study that we are participating with. It's a multi-center study initiated in Switzerland in our sister hospital group, and it involves actually something that we routinely do for breast cancer patients. And we are talking about a certain group of breast cancer patients who have more aggressive disease, and we treat them with chemotherapy. So in the recent years, we have given chemotherapy more and more before we even do the operation. So we give this medical part at the beginning, and we see how is the breast cancer handling that. And we see when we pick these patients with more aggressive disease that in 60 to 70% the cancer actually goes away completely or nearly completely. And we tailor-make then with the operation, we prove what has happened. And after the operation, we can then decide, does this patient need an escalation, meaning more treatment to make the treatment okay? Or can we stop there and de-escalate the treatment? That means less medical stuff. We still would give radiotherapy though, because this is part of it. But even in the future, I do see changes coming up there as well. So at the moment, we do chemotherapy, then surgery, then radiotherapy for most of the patients. And we see when we do the operation, we remove the tissue, there's actually no cancer left. So this study looks at doing more imaging before the surgery. How sure are we with an MRI of the breast that the cancer is gone? And then we do a biopsy with a big needle under anesthesia. It's not painful. And we remove a big area around the previously placed clip where the cancer was sitting. And we look at that. How good is the MRI? How good is the biopsy? Can we in the future avoid an operation for these patients? I mean, surgery is not a big part of the treatment and usually is tolerated well, but we could save something for the patient. Still, it's an operation. It's general anesthesia. It's a change in the breast. So
Recovery.
Nobody really wants that if it's not necessary. And this is where we stand.
With drugs trials, and I'm talking in general now, it's kind of twofold, isn't it? It's the decision of the medical professionals to say this person is a good candidate, but it must be very conflicting as a patient to say this is something that I want to do. Can you talk to us a little bit the psychology of a trial?
Well, the patient will not miss any treatment part, so this is the most important. Everything is as it should be. The surgery is going to happen. You have this treatment, and surprisingly, when you tell this to a patient who has had already, let's say, a few weeks of treatment of chemotherapy, when you tell them, listen, you don't miss anything on your treatment, we just want to make things easier in the future for other patients who have the same what you have, we actually find open ears, and patients say, yes, if I could help someone in 5 or 10 years, not next week, we are not going back to the office and do this on Monday, they're actually open for it. Even though that they are suffering at the moment, they still want to help someone else. It's great to see that.
It really, really is. I was just saying to your fair that my best friend's taking part in a trial in the UK right now, and she has stage 4 breast cancer, and that's very much her philosophy. It's like, this probably isn't going to be something for me. I mean, it would be amazing if there was some kind of short-term impact, but as you say, it will take time. It will take time. Yeah. It will take time. Look, I mean, you've been in the UAE now for 17 years. If we could kind of fast forward in your mind to the next 10, 20 years when we look at breast cancer, what are some of your hopes, Dr. Annett, when it comes to things that you are going to have in your toolkit to be helping and saving women?
Looking at this long time, I see a lot of change already. We have much more awareness.
I mean, we all do a good job. You talk to your friends, I talk to my friends, we talk to kids in the school. So awareness for breast cancer particularly, because it's my interest, has changed a lot. So women come for screening. Women take their moms, take their aunties, and they go somewhere if they find any change. And I hope that this is going to improve more and more, that we see more earlier stage breast cancer, not the advanced. So the treatment relies on studies, on clinical trials and improvement, and that's incredible. I mean, when I was a younger doctor or a student, surgery was always the same, and now it's a whole complex scenario what you can do, from oncoplastics to reconstructions. We know that keeping the nipple, for instance, is safe when we remove the breast. So many things. It has changed a lot, and I hope that there might be, even for some patients, no surgery. Even being a surgeon, I hope that we don't do this anymore.
We hope we never have to meet you.
Yes, of course. But in the clinic, we do not only have breast cancer patients. We do lots of screening as well.
And that's exactly the point of this whole month, isn't it? You know, it's about people getting into the habit of self-examination at home, of knowing where to go should they find a lump, of knowing some of the methodology that's available to them, whether it is ultrasounds or mammograms, and keeping that conversation going, because when there is shame and stigma and ignorance, and I don't mean to use ignorance in a negative way, but simply gaps in knowledge, unfortunately cancer loves that.
Yeah, and if we are ashamed to go somewhere and we think, oh, I've done something wrong in my life, that's why I have that, that's not right. So if you feel that there is a change, you feel something is not all right, even if you have been to one place and they told you it's okay, but you still think, no, something is weird and off, please go and get checked again.
Dr. Annett, thank you so much. I think it's really encouraging to be hearing about some of the amazing work that's been doing, you know, here in the UAE, internationally, with, as you say, those views to things being even better in the future. Dr. Annett is a consultant breast and general surgeon, the clinical lead of breast cancer there at Mediclinic City Hospital. We are, of course, continuing our conversations around breast cancer awareness, everything from the psychological side we've touched on. And of course, if there's anything that you want to share or any questions, you are more than welcome to reach out. We can connect you on 4001 on the app,